Well, you're tuned into the Zelos podcast. I'm your host, Rocky Snyder. This week, Dr. Arianne Missimer is with me. Not only is she a physical therapist, but she's into functional medicine, and we're going to dive deep. Plus, you can catch her in Chicago this June 12th to the 14th at the 3-day functional summit that Perform Better puts on every year. Just go to performbetter.com. Tons of presenters, great networking, awesome opportunity. Also, the NSCA National Conference is happening this July 16th to the 19th, Kansas City, Missouri. I'll be there presenting as well, so hope to see you there. Be sure to check out Satanta College if you're looking for a Master's of Science in a whole bunch of different tracks. Just put RS10 into the code for 10% off tuition today. Check out my website, rockysnyder.com, for continuing education, for blogs, podcasts, training, and a whole bunch more. Be sure to follow us on Instagram at Rocky_Snyder. Click the subscribe button. Here we go. Well, Doc, I can't thank you enough for putting a little bit of time aside to come on the Zealous podcast. I've been excited to talk about functional medicine, breath work. You know, that seems to be the haute couture in the last couple of years. We're talking about diaphragm and breathing. It's something we've always been doing, but we've been told we're doing it wrong. So I'd love to learn about your perspective. But before we get underway, welcome to the podcast.
Thank you so much for having me. I'm super excited to be here.
And it's a joy to have you here. For the listening audience, Dr. Missimer is going to be at the Chicago Perform Better Summit, and that's going to be in the middle of June. Do you know the actual dates? I think it's the 12th, 13th, and 14th.
I think that's right. Yes.
Yeah, Thursday to Saturday.
Thursday to
Great
Saturday.
time. So we'll talk a little bit about that. But first, how did you follow your career path? You've got a doctorate in physical therapy or CSCS, functional medicine galore, but how did you get there?
Yeah. So I started, I'd say really at 17 was when I started personal training. And I did that from having some, unfortunate situations that happened in my life. And strength training really gave me, I always say, my power, my freedom. It gave me more mental strength and emotional strength to get through what happened. And really from there, it was a fast trajectory. So I started personal training. I was working at Gold's Gym and trying to get all my own clients. I did a fitness show. And shortly thereafter, sadly, I lost my brother to cancer.
Hmm.
And that was a huge life changing moment in my life because he really gave me my purpose. And even though I was on this path to health and wellness, I really walked with him literally through, going through hospice, and he lost function of his arm and leg. And I was his physical therapist, even though I wasn't one at the time. And when he passed, I just realized that, okay, this is what I want to do for my career. I really want to help change lives. I never want to let anyone take their health or life or movement for granted. And I had really kind of gotten into my major, which was dietetics, so nutrition dietetics. I had a fitness minor. And I opened my first personal training studio at 21, just under 22 years old.
Whoa, that's early.
It was super early. So, but it was amazing. And in some ways, it was really helpful for me personally because it allowed me to grieve. I put everything into that. And so I was very emotionally attached to it, but it was one of the best things that I ever had. And so I was seeing all of these people that were coming into a fitness setting with pain and injury. And they would be coming from physical therapy, they'd be coming from orthopedics, and everyone still had pain and injury. And I just kept saying to myself, why? They've been in PT for 8 weeks and they're no better. They don't move better, right? They still have
Hmm.
pain. So I had really wanted to be a physical therapist initially. So I decided to, which was a big decision because I was running my business and I thought like, okay, this is big to go to school full time and run a business, but I knew that that's what I needed to do. and
Wow.
and I was pretty obsessed with human movement, which is when I started going to the Perform Better conferences and really just getting, I'd say obsessed is a good word. And so I went back for my doctorate. When I finished that, I was 30. And at that time, everyone said you should really work someplace for a year to get some experience, work in an outpatient setting. So I decided to do that. Fast forward 8 years later, I was running my
Wow.
business and I was also I was a clinic director at a physical therapy clinic and, kind of burning the candle, we'll say a little bit. And then I actually had cancer. So I had stage 3 liposarcoma. So it was a really rare aggressive cancer. It was 2 months before my wedding. And I decided during that time to train for American Ninja Warrior. So I did that. And when I finished that, I had a lot of time of reflection of, okay, where am I right now? What am I doing? And I also always believe so strongly in mindset and nervous system regulation and the emotional mental health aspect, in addition to obviously the physiological things like nutrition and fitness and so on. And so I did my graduate work in mindfulness. I really dove deep into somatic work and nervous system regulation, did my yoga teacher training, all of the things. Still was kind of having this moment like, what can bring it all together for me? And that's when I sought out functional medicine, and quite frankly did not have an amazing experience. I was post cancer treatment, and I was trying to find all the answers. My body was falling apart, and I decided after that that I said I need to do this too. I need to follow a path and really be the change that I want to see. That's always been my philosophy, is be the change you want to see in the world. And so every aspect, whether it was nutrition or PT or fitness or functional medicine, I felt like I wanted to be the difference. So I did my training through Institute of Functional Medicine, and then here I am today. So opened up an integrative health center where we really focus on whole body wellness. So our tenants are holistic physical therapy, functional medicine, and nervous system regulation. And we integrate all aspects of that to help someone heal and thrive.
Fantastic. Wow, you summed that up quite well. Okay,
Short
so
version.
yeah, so I'm curious, you having experience with all of these people coming through the facility that are experiencing symptoms of pain of some sort, and yet you, as you say, they've been through weeks and weeks of physical therapy, and then you dove into physical therapy school. Did you
Mhm.
find out the answer to your question as to why?
Sure. Yeah, definitely did. So I loved PT school. I think any schooling that I've done, I can appreciate that you have to have you're learning a really deep foundation to be able to learn from that. Right. And that's what I feel like it did for me. I loved my school. I loved my professors. Is PT school where you're going to learn about movement? I know that that sounds silly, but no.
No,
Right. And that's
sure.
okay. I think that's where that practical aspect is being able to just work with humans and train people, right? And see all the things and all the compensations that they have, because it isn't really where what you're getting in PT school. And so it's just like nutrition, though, right? So, like, nutrition provides you a really good foundation of organic chem, biochem, but is it really teaching you how to help someone really make life changing decisions as it relates to nutrition? Maybe not. Right. So I just believe you just have to keep taking it a step further, like we were talking about, is continuing education and just learning more and more and more, and also working with a lot of humans to be able to synthesize all of that together to truly help someone change.
Well said. I think the same holds true for personal training and
Hmm.
strength conditioning certifications. You know just enough to be dangerous. It's the
Hmm.
good fundamental stuff, but what you do with that knowledge and how you expand upon it afterwards. I do recall in the early 2000s taking a couple of physical therapists down to the Long Beach Perform Better Summit. And this was when FMS was really evolving into what it is. And
Hmm.
they weren't familiar with those. They were just not fresh out of physical therapy school, but they had their own practices, and I was just talking about different things, and they were scratching their heads. So they said, "Okay, we got to go with you." And they came. And after one day at the Perform Better Summit, I remember we were at Rock Bottom Brewery in Long Beach, which no longer exists, but they were peppering me that night with question after question, going, "Okay, how is it that you know these things, first of all, and we just spent all this money in physical therapy school and this wasn't taught?" Well, it's just not in the curriculum. So it's
Right.
what's afterwards, like you say, that it really is. Okay,
Hmm.
let's fast forward a little bit. Tell me about functional medicine, because I've got colleagues or people in town that do practice functional medicine, but I've never really had a sit down talk with anybody that is really deep in it like yourself. Can you give me a layperson's term, because I'm not a rocket scientist by any stretch? What's functional medicine?
Yeah. So I'd say it's a whole person approach that really caters to root cause medicine. and it is based on systems biology, i.e., how do all the systems work together. I'd say that's the easiest way to explain it, because so often in medicine we're in so much more of a reactive approach or a symptom based approach. I have pain, let me take an Advil. I have, a headache, let me take something. And so, right, we're always thinking about what we can do to band-aid the situation. And I am not at all against Western medicine, not even in the slightest, because I always say I would be dead if if I
Right.
didn't have Western medicine. So right, it's not, I think the other misconception is that some people think it's not medicine. It is 100% medicine, and it's just, but it's looking at it through this lens of how do all the systems work together versus an isolated specialty of I have bloating and IBS. Okay, we're just going to look at the gut. No, we should be looking at the gut, and we should be looking at the nervous system, and we should be looking at how you're detoxifying, and we should be looking at, really any aspect of your health. How are you sleeping? Because if we're just looking through the lens of you have bloating and IBS, then we're missing all of the other aspects of why this might be happening. And so that's where that root cause piece. And I always say that it's not root cause, it's root causes, and we can never be 100% to say this is exactly why this happened because our bodies are so complex. But when we can really understand, let's just say, for example, someone comes back with labs and they have prediabetes, and then they say, but hey, I'm not really eating any carbs, right? I'm eating low carbs, or I'm not eating any additional sugar. And of course there are some people who may say that but might actually be doing that, right? I mean, obviously we know that. But then there's other people who maybe they've been really, really careful of it and mindful of it, and then you start to look at how dysregulated their stress pathway is and how much cortisol they're producing, and looking at, their patterns throughout the day. And then that could be the reason that they are pre-diabetic. So just by saying, oh, well, let's just watch your carb intake isn't going to be very effective, right? But
Certainly.
understanding how to manage their stress levels and their resilience throughout the day is going to be really core.
And so when I'm just thinking that you have several pages of assessment sheets that you ask people to fill out, and that the initial consultation appointment is probably going to be somewhere in the neighborhood of 90 to 120 minutes. But am I wrong with that? Like, how does it work?
Yeah, yeah. So I can talk you through it. So I actually do my evals in an hour, but I spend
Wow,
I spend 30 prior, 30 after. So it's
got it.
more prepping and following up. So what I do is, so someone would have, I'd send them all their intake form. So it's 70-page intake form. It's very, very
Yeah.
thorough, looking at every aspect of their health. And also, so let's just say lifestyle factors like sleep, nutrition, movement, and so on. But then it will also have lots and lots of checklists of symptoms, which is probably the most helpful for the patient and then also for me, because they're starting to reflect on things that they didn't even know were an issue. I have dark circles under my eyes. I have itchy skin. I have dry skin. I have ridges in my nails, right? All of these major signs of potential nutrient deficiencies, maybe malabsorption, right? All of these things. So it's a great reflection for them. And I always tell someone that when I'm doing a discovery session, I said, this, yes, it might seem daunting when you first look at it, but really take this as an opportunity to just sit and see, what is actually going on in my body. And so after that, I will organize it before I meet with them into all the systems of the body. So anything that they've written on their intake form, written or checked, I assimilate that into what's happening in their gut. So how are they assimilating food? How are they, like, what's happening in their immune system? What's happening from a structural integrity standpoint? So do they have a history of tendon issues and joint arthritis and lots of injuries, surgeries, all of those things? Mitochondria, do they have chronic fatigue, chronic pain, headaches, migraines, anxiety, depression? Then we'll go into endocrine system, which could be, obviously look very different. Everything from cortisol to sex steroids and so on. Then we would look at how are they detoxifying, how are they transporting, so lymphatic system, cardiovascular system, and did I miss any? Mental, emotional, spiritual, the most important. How could I miss that? So once I do that, when I first meet with the patient, we'll go through a very, very detailed chronological timeline. And we'll go per decade and weave in anything that they've written. But then I'm also asking them a lot of questions. So did you have strep infections when you were younger? Did you get ear infections and you had to get antibiotics? So every little detail, which I know we're going to talk about airway health, I'll ask a lot of questions like leading into each area of their life. And so after that, I'll be able to come up with what is my assessment, what's my clinical assessment based on the information they've provided. Why do I think it's happening? What is happening? What do we need to do? And then what information do we still need to confirm that? So perhaps we need a stool test. Perhaps we need just basic lab testing. So we'll figure out what other additional information is going to help us to confirm my assessment of what's going on.
Oh, that's great. I I'm fascinated by the human form. Obviously,
Mhm.
we're in the same kind of category there. And one of the fascinations is patterns that emerge that were up to that point unknown, unrecognized, or whatnot.
Mhm.
You must bathe in that. You
Mhm.
must see so many remarkable patterns that
Mhm.
to the to the average eye, does not appear obvious. But to your now well-trained, knowledgeable mind, you go, oh,
Yes.
okay, we should probably start hunting down there.
Yes.
But can you give me a couple of I know not for a fact, but I have a pretty darn good instinct that this has occurred with you. Can you give me a couple of examples?
Yeah, yeah. So I'll do the one that I think is really fascinating. I'm super passionate about, which is sleep ultimately, and airway. So when I first start doing the timeline, and I've also already figured this out mostly from the intake form too, based on everything they've checked. So let's just take an example of, say someone says they have chronic postnasal drip, they have a dry cough, they have eczema, and they have some form of insomnia. So maybe they're waking up a few times a night, maybe they're having trouble falling asleep, maybe both, but kind of some version of that. And then they also feel fatigued. So I already kind of know, I'm like, oh, there's definitely a sleep issue. Now, I don't know necessarily just yet, is it a sleep issue because of really poor sleep hygiene? Which is of course sometimes, but in this case I would already assume that there's probably some airway dysfunction. So then when I start to do their timeline, I will be able to ask, like I said, like, did they have strep, did they have ear infections? Normally when you see that a lot as a kiddo, then most often it's some type of physical obstruction. Then I'll say, did you have some focus issues as a kid? Maybe not diagnosed ADD, but maybe, or maybe ADHD. Or did you feel like kind of reserved, shy, quiet, or you'll see these like personality patterns as a kid? Then they'll kind of start to like maybe teenage years, like they might say, oh, I was kind of a light sleeper, like I would like maybe college, right? Like was kind of a light sleeper. And then you'll start to see these like changes as they get older, whether it's they started to develop more anxiety. So they've always had anxiety. So if someone says that to me, and I'll ask them, have you had anxiety? Do you have anxiety related to emotional triggers, or do you just have anxiety all the time? And if it's like this, and when I ask them that, they know exactly what I mean. And they'll be like, well, now that you ask that, I probably have it all the time. And I would say, in that case, it's likely a physiological driver. It's probably
Mm,
not just that you have too much stress in your life. That's plain, it's perpetuating it, but there's an underlying physiological reason for that. And so fast forward, so I typically work with 40 to 60 year olds. So each decade you'll just start to see these like other little layers to it, and then I know that, and then I do airway screens, so I'll be able to say like, okay, this is what's happening in your airway, I think you need a sleep study. 100% of the time if I refer somebody for a sleep study, I see sleep apnea or upper airway resistance. So I kind of already know that that's the pattern, and they would have never, they've been to all these doctors, right? And they can't get better. Their nervous system is so dysregulated, whether it's anxious or depressed or whatever it might be. And they have all these immune health issues. And it's because they're never restoring, right? They're never sleeping well for probably 20, 30, 40 years.
crazy.
Crazy. Yeah. So I've become a little bit like, I'm just so passionate about it. I work closely with a dentist who specializes in airway health. So I can screen it and identify it so quickly right now. Now, I'm not the one that's fixing it, but I know how to get people where they need to be to fix it.
Well, and this goes along with a good segue into the Perform Better Training Summit because
Mhm.
you're going to be speaking on airway. What's the actual title? Do you recall what you're?
So it's the missing link airway function and its impact on core stability, recovery, and performance.
Okay, give me a little sneak peek about what we're talking about there. How do you
Yeah.
assess somebody's airway?
Yeah, so we can do an airway screen to look at everything from some nasal obstruction. So if they have a nasal collapse, nasal valve collapse, we look to see if we open up the lateral wall of the nose, like are they able to breathe easier? We can look at tongue range of motion. We can look to see is the tongue taking up a lot of space in the airway. So that's something called the score. And we can do look at the palate. So is it kind of narrow? Is it, appropriate size? So there's a lot of little like very specific screens that you could do to just say, okay, yes, this is indicative of potentially some type of airway issue. And then there's also a lot of questioning that you can do, right? Of all the things that would indicate either poor sleep or airway function as well. So really that combination can be the screen for it. And how I started with breathing was really early on. Like, first thing in my career, I was obsessed with breathing and intra-abdominal pressure. And should you brace or should you draw in or should you breathe, right? And then it evolved to really understanding breath work. But now my work is really not just try to breathe better, but it's if you have an airway issue, you can't breathe better. Right. So it's kind of like understanding like who is the person that you can just teach breathing techniques to and help to optimize them. Right. And then who is the person that you really probably need to refer because ultimately it's going to affect their ability to stabilize, which, as we both know, right, that means their ability to generate force. Right. If you can't stabilize, you're always going to be limited in how much force you can generate. You're going to be more prone to injury. You're not going to recover well, right? So it's kind of this downstream effect. So what I'm hoping to do is really just educate people on first just bringing some awareness and shedding some light onto it of kind of like there's this other whole world of breathing that isn't
Yeah.
just extended exhalation breathing and paced breathing, right? Those are all great. Buteyko breathing, I love all of them. But being able to really shed some light on, oh, this person actually can't physically breathe well. Because that was always my question that I would be working with people and I would so, I taught everybody breathing, no matter who they were, what they came to me for. And there would be these moments where I just thought to myself, gosh, this person really can't breathe, like no matter what cue I give them, right? But at the time, I didn't know enough to really think why that was happening. And now I can really understand that like those are the people years ago I would have said, oh, you need to see this person, right? We need to evaluate this at a deeper level.
Certainly, and what you're intimating also is is how much dental work or the structure of the mouth comes into play with that. So unknowingly, we go and get some type of corrective devices, whether
Mhm.
it's retainers,
Mhm.
braces, or you have some type of surgery.
Mhm.
If you're born cleft palate is one, right? All of these different structures are going to greatly affect your airway capability, and therefore could be the first kind of hurdle, the physiological kind of domino that falls, so that decades later you are encountering so many various and seemingly unconnected symptoms when in
Mhm.
truth we can follow the root cause all the way back to that particular event.
All the time. Yes. Yes, yes, yes. Because even one example is, which we hear all the time, right? Is I clench my teeth, right? So I have a mouth guard. And quite frankly, in most cases, that person has an airway issue. Yes, stress can play into it. And, subconsciously it can increase the trigeminal nerve and how we are clenching, right? In the sympathetic nervous system. So yes, that is a lens, but the other piece of it is they are probably clenching because they have some type of structural abnormality. And so
Yeah,
then you put in a mouth guard and they clench more, right? So yes,
sure.
in a sense it sort of protects the teeth, but doesn't really because it's creating more clenching over more years and time.
You're
So
just kicking the can down the street,
just
really.
kicking the can. Yep. Yeah, and these are like when we talk about patterns, right? These are the things that I can see, I hear, see, and I'm kind of like, oh gosh, this, And sometimes it's just getting the patient on board and helping guide them along the journey of what to do, how to do it, and also again just opening their mind to it because no one's ever told them that. So they're going to all these people, including functional medicine doctors, right? And they're treating their gut and their hormones and I always start with the nervous system. So I always say, okay, like if you have all these things going on, the nervous system is the issue, right? It's not that you have a mold issue and you have a gut issue and you have a hormone issue and you have a nervous system issue. But then the question becomes, why do you have a nervous system issue? And that it could look different for different people. Sometimes they're living in a toxic situation, but then other times it's something like sleep. Right. So it's kind of like
Yeah.
there's a reason why the nervous system is dysregulated. So it's kind of just taking it a step further instead of trying to out supplement, out, do all these things, out protocol it. Right. Trying to be a little bit more deliberate about like what is, let's like reverse and reverse and reverse so we really understand it.
So there must have been moments where you have encountered paralysis through analysis. Like there's so many moving parts. There's
Mm-hmm.
so many pieces together. And so what I typically do in those moments is I take a breath, I take a
Mm-hmm.
deep breath and go, let's just go back to the basics.
Mm-hmm.
I know there's so much noise around me, but what and for me, from a biomechanics standpoint, what can that hip do? Or what
Mm-hmm.
can that spine do? Or just start somewhere and let's just, I need a place to start. Do you have that same kind of approach when you encounter so much noise that it's hard to really discern?
Of course. Yeah. And I think what makes it challenging is that every person I come to has so many things. I mean, the list of things that are happening are so extensive. So to your point, I always have to do that. I always have to
Yeah,
kind of take like my pause is it's kind of interesting, right? So it's kind of like, okay, what is my assessment of them? Like what do I think is happening? But then I have to go to why did they come to me? And then that changes because then their goals shift after I've assessed them, right? So then we
sure.
have to keep having this conversation. It's like, this is an example this week of weight. So people are having some significant metabolic issues. And so my evaluation is that they're under chronic stress. They, yeah, of course there's nutrition things, there's movement things, all this. So I'm trying to set them up for how do we improve your metabolic health, your cellular health, and that does look very different for each person depending on what's going on. But then their goal is weight, so the only thing that they can see is, did the scale move, right? And where I and then my mindset is kind of like, oh, now I've gotten this person to eat 1,800 calories versus 1,400 calories and they haven't gained any weight. Whew, that's a win, right? but
Sure.
but it's like I have to always reflect back on, why are they here, why are they coming, and that's what sometimes makes it hard because I always feel like my assessment, I feel like I have a really good grasp on what's going on and why, and also how to approach it. It's just that most people want the results yesterday.
I hear you. Trying to meet client or patient
Where they are.
expectations, but
Hmm.
also know that there's a difference between what they want and what they really need, right? And
Yes.
trying to marry those two things together, can be a very big challenge. Like,
Yeah.
how do you get them to buy into the fact that the reason this is going on is not because of what you think's happening, that you're eating too much or you're not exercising or whatever the case may be. It
Yeah.
actually has to do with this issue that occurred about 15 years ago. And here's what's been transpiring since then. And one of the byproducts is what you're experiencing right now. Like
Mhm.
that must take some time for most people, does it?
Yeah. Yeah, yeah. I think that the win is that they are so frustrated with where they are. So the second that someone truly listens to them, I
Mm,
truly believe is the most important part. And that even if I will be the first to admit if I don't have it all figured out, I will openly say that. I'll say this is what I think, But quite frankly, I do think there's a few missing pieces that either I just don't know the information yet or that we still need to figure out. And normally it's that they haven't shared everything. When I say that, it's normally because they haven't shared everything. And there's these obvious kind of missing pieces of the story. And I'll normally get there eventually. But that's when I feel like if I listen and I can explain to them why and really educate them, they are normally, I would say, very on board in the beginning. And then there's always a moment somewhere along the line of frustration because they're not getting there fast enough. Like I
Mhm.
feel like almost everyone has it. And I just kind of, and if I think of just my whole career, whether it's PT or fitness or all of it, I don't know if I ever remember that not happening. So like I just believe it's just human nature, right? I mean, it's kind of like, and not that they're angry with me, it's just like they'll have a moment like, oh, I know, but I just wish the scale would budge, or I know, I just wish that my bloating would go away, or like, like a gut is what I treat so much of, and so gut, if they are having specifically constipation and they have chronic constipation, which is so many people. I mean, yes, there can be physical abnormalities like a redundant colon, and yes, they can have IBS-C, but
It could
there
be a
is,
major mental and emotional thing too, right?
yes, but there,
Yeah,
and I would say always a nervous system component, because
yeah,
that's when motility suffers, right? If we're in a fight or flight, if you're
yeah.
shoving down your food and you're multitasking, you're in a fight or flight, right? And you're going to slow
Right.
your motility and digestion. So then, like, I know that, but it's like trying to help someone really adopt it. Like I know it, I can give you the tools, I can, like, all the things. It's just that everyone has to kind of get there in some respect on their own time, you know?
Yeah, I do. I totally do. I mean, yeah, we experience it on a daily basis. So with the people that see me, the people that see you, they may be coming in for different reasons, and we have obviously different avenues to get to the end result. But ultimately, there's always that level of frustration, like you say, that kind of percolates to the surface eventually. And
Hmm.
until they have some level of acceptance or awareness, and have that willingness to really do something about it, which is the kind of the crux, because we're talking about people that have to take some responsibility more than what they have been told they need to take. And
Hmm.
what I mean by that is, as much as Western medicine has to offer, what they do offer is an easy way out as well.
Hmm.
So all you have to take this, and then all your troubles are solved. But
Right.
that's not necessarily it. So here we go. So with that, do you get a lot of pushback from the Western world that you so love and appreciate, or is it something that you've found people in the medical field going, "Oh, I'm so glad you're out there. I'm sending people your way." What is it?
I would say more of the first and
Yeah.
a little bit of the second. And I think that it's in a sense, and I don't know exactly the reason, but if it feels like a threat to their medicine rather than a team approach. So how my goal is, whenever I'm talking to my patients, I will say to them, listen, I'm going to try my best to work with your medical team. So if you have a pre-CP, I'm going to give you suggestions to ask them for blood work. I'm going to give you suggestions to maybe ask for sleep study, whatever it might be, because first of all, the patient is very, very grateful for that because they want everybody to work together, which is what healthcare should be, right? Is a team approach. It's not that
Yes.
I have all the answers. It's not the PCP has all the answers. It should be we're working for the patient. And so that is always my goal, but quite frankly, there's a lot of pushback, right? Oh, you don't need these labs. These are going to be so expensive. We're not going to do them. Like there's a lot of that. But then there's some that are very open to it. And so that those are the ones that I just keep thinking, I'm just going to keep doing what I'm doing. And, I can order any one lab. So it's not really, that isn't really the issue. It's more just trying to have this collaborative approach.
Yeah, truly. And the more we can build up that team approach, the stronger the network of professionals
Right.
become, the more open the channels of communication are, the lowering of shields or defense mechanisms are there. I mean, it's win-win all the way across. Doc, I
And
can't
then
believe
people are
you go ahead.
healthier. I was gonna say, and then our patients are healthier for it,
Oh,
right?
yeah, that thing too.
Oh
Okay,
yeah.
yeah, I guess we could consider that something.
Yeah.
But this time has flown by, and I knew I had this sinking suspicion it was going to. You just have an abundance of knowledge and wisdom, and I'm so glad you're going to be sharing it. Chicago, performbetter.com. It's going to be a training summit of basically 2.5 solid days of in your face networking, learning, and more. Just go to Perform Better, check out their seminars. June 12th, 13th, and 14th, I believe, will be in Chicago. But if people are interested in your work specifically, and I imagine you do online consultations and not
Yep.
just in person, so how can people find out more about Dr. Arianne Missimer?
Sure. So you can go to our website, themovementparadigm.com, and then the Movement Paradigm on all the social media platforms. We have a lot of education on YouTube, Instagram. So you can always check us out there. Shoot me a DM if you're going to be in Chicago. I'd love to meet you.
Beautiful. Well, thank you so much for your time. I really appreciate it. And I can't wait to meet you in person in just a couple of months.
Definitely. Thank you.
And that's all she wrote for this episode of the Zelos podcast. Thank you, Arianne, for coming on. Really appreciate your time and expertise and got a lot out of it. And you can get a lot out of Perform Better's 3-day functional summits. Just go to performbetter.com. If you're interested in learning more from rehab to elite performance, the presenters there are the best in their class. So hope to see you in Chicago, June 12th to the 14th with Arianne. And if you can't make it there, July 16th to the 19th, NSCA National Conference, be sure to check out my website. And while you're there, check out my book, Return to Center. We'll see you next week.